Good morning, guys. It is the weekend. I hope everybody's got some exciting plans and had a good Friday night. I am making a video, but it's going to be kind of the beginning of a little bit of a mini series of videos. Of course, I'll do videos in between because I just like making videos and I always have stuff I want to make videos about. But I'm going to do a bunch of videos for, again, nurses, new nursing students, new grads, and just nurses who may be new in a new role, a specific role, or have left nursing and have come back, that sort of thing. So I've got a couple videos in mind, about 4 or 5 actually, and I'm going to work through those. This one's the first one, and this one is about 3 golden opportunities to prevent a medication error. So if you're a nursing student, these have been drilled into your head. Maybe not the way I'm about to discuss them, because I do some different things and it's led me well. I've never made an error. I've never come close. In fact, I've caught numerous nursing errors or medical errors from both doctors and other nurses. And I've been able to intervene and stop those errors before they reach the patient. So I've got a pretty good system. So I'm going to discuss that with you, and that'll be it. It shouldn't take too long. So the first, of course, is I'm going to tell you is that I think it's super duper important, I know it is, to not only know your medications, know what drugs are for what, have a basic idea, just learn your prefixes and suffixes basically, and you'll have an idea if you don't want to learn the whole meds, but you'll give the same ones on the floor, you'll learn that. So going through the first week on a floor, or if you're in an emerge or anywhere, learning about each med you use won't serve you wrong, because you're going to keep using the same meds. So it's good to be familiar with those and know what they're for, what the usual common recommended dosages are, and what the contraindications are for them, and also if they're a reversible medication. So that's always important as well. Second thing I think I really need you to know is you need to know your patients. Not everyone does. They know patient in room 3C or 2B or whatever, and they know they've got their little list of patients and their names beside it. But take a few minutes when you do your head to toe when you get a new patient to get to know them a little. Like, what chronic conditions do you have? Just chat with them. Like, what long-term stuff? Have you had any surgeries? Do you have any pain anywhere? What other meds are you taking? And all of that's in the chart, but it's nice to hear them tell you that too, because it's confirmation, and it also helps to build rapport between you and the patient, and it builds trust too, which you really need to have. So it's really important to know your med and the reason your patient, and the reason is because if a doctor writes an order, and I've caught med errors this way, and it's for a certain drug, but you know a patient doesn't have the condition that that drug is usually used for, that's a moment for you to second guess, why is this patient being prescribed this med? Is this an error, or is this something going on that I'm just not aware of? So that's a golden opportunity, and I have caught numerous errors just specifically in that action. Sorry for the water chugging. I'm not even going to explain. You guys know about this. So anyway, those are the 2 additional things I'm going to tell you. Really know your people and know what meds you're giving. So your first opportunity to stop an error that you can catch is going to be when you receive your orders. And that's when you know the medication a little bit, and you know the regular orders for it. You know if there are altered orders for people with kidney disease or liver disease, if there's a regular change that's made to the prescription. You know your people, you know the order, you know if the drug suits the patient and if it makes sense. And that's the first place where you can stop an error, by having that knowledge and having that information, and then receiving your orders from your doctor and having a good look at exactly what that doctor is prescribing for that patient and making sure it makes sense. Because if it doesn't, it's really easy. Just go to the doc and say, can you explain to me why this is being prescribed? I don't understand. If you put it that way, then it's not insulting when they look at it and say, oh God, oh darn, damn, like I didn't mean to write that. Do they have, oh really, they have kidney disease? I didn't know that. Oh, so glad you brought that to me. And they changed it up. So it's just in how you frame it when you go with your question that is going to lead to you getting the answer you want without any hurt egos and bruised knees. So there's that. And then there's going to be, when you are reconstituting or drawing up, let's say drawing up your med, or slash preparing it. So that is your opportunity to look at it. Make sure if you're reconstituting that you do that properly and you do that by the book. Like, look it up, pull up your book every time, even if you think you know, and take a quick peek, have a look and see what the reconstitution is. Even if you've done it 30 times, just once in a while have a peek. Make sure you're not having a conversation in the med room with another nurse while you're doing it. Just say, hold on to that thought for a second, let me do this. And then it's easy to say, hey, double check this for me. And then you not only were safe doing it, but you also got another nurse to double check your meds. So, like, that's a double bonus right there, just because you happen to be in a conversation while you were doing it. So it's not rude, it's just safety. So you want to be able to do that, and just pay really close attention when you're drawing it up. Pay close attention to your units of measurement, I would say, because doctors do change that sometimes and they expect you to catch it, but they don't flag it or write it in red or underline it, which I really feel like it should be a process, but it's actually not. So they could change something from mils to milligrams, and that changes your whole dose, like, in a big way. And that's something you want to pay attention to. You need to know if that's been changed. So you need to pay close attention when you're drawing up and preparing your meds. And your third one is going to be at the bedside, giving it. This is your opportunity to say to the patient, this is what I'm giving you. This is how much. This is why I'm giving it to you. Have you ever had this before? What dose were you on before? Do you know? Have you ever had any allergies to medications? Anything like that? Yes, it's in the chart, but it's always good to ask them, because they forget sometimes when they're being asked at triage, when they're filling out their chart, or by their first nurse when you first saw them and assessed them. So at the bedside, you're going to do your checks. You're going to do all your checks anyway. You're going to check their armband. You're going to check that it's the right route, right med, right time, right place. Like, all your rights, you're going to make sure you've done. And that'll keep them safe. And if you make sure that you do have a good chat with your patient before and after you give it, you're going to have no problems. You're going to be able to give that medication safely, and you're not going to have any concerns. And you were more than safe, and you've done more than most nurses did. So pass it around. Share your process with other nurses, and do it proudly, because you're a safe nurse if you're doing these things, and you're really helping to protect our patients, which we need more nurses stepping in to do. So that is all for today. I just wanted to discuss those few points. And it sounds like a small issue, but it's a huge, humongous issue. I forget the percentage, but there's quite a few deaths related per year to medication errors in hospital or in facility, and that every one is one too many, because there's no need for that. We're smart people, and we really have the opportunity, the education, the knowledge, the experience to catch these errors, and to draw attention to them and get them corrected before any harm is done to the patient. So that is all, guys, and I hope you guys have a great weekend, and you'll see me before the end of the weekend. I'm sure I'll make another video. I hope you guys are sleeping and wake up and have a lovely day. I will see you all soon. Oh, and guys, please don't forget to like, give me a thumbs up, and subscribe if you like my videos. I would really greatly appreciate that. And with that, I'll go. Thank you.